Very good morning to all of you. Thank you for coming. I have many friends here who have come to support this talk. And I would not want to bore you with too many of those. In actual fact, this is a very interesting forum for us to actually, after listening to our distinguished speaker, Dr. Aru, right, Professor, he has actually touched base on all the topics that we are also interested about is anti-aging, right? Active anti-aging. I like the word active. So obviously, let me just move on. I would like to, as the founding president of the World Traditional Medicine and Healthcare Association in Singapore, we are pretty young actually. We're just a few months old. Right? So we open for any of you to come and join us. Right? So, well, I'm not a doctor. Someone addressed me as doctor. I'm not a doctor. I'm just a Paul Harris Fellow and also an MBA person. My background is actually in engineering, right? And as you can see, that I also involved in other areas like SG100 advisor. Here's my SG100 people. They're here. And also, I'm currently also engaged with Energer in the business development area, right? And I'm the past president of Rotary E-Club. Okay, so if you are members of E-Club, our Rotary Club, you know that we are actually a service-oriented organization. So this is our vision for this coming pointers. As you can see here, for our vision is to uphold and promote traditional medicine. Okay, the reason being is that a lot of time people are thinking more of like, traditional medicine is all those very serious, sing say, old person, they are even the traditional Ayurvedic medicine, right? They're the guru, right? But I think what we're trying to do is to inject new blood and new power, energy into this traditional medicine. And obviously, we want to modernize traditional medicine, right? And this is to bring it to relevance to the younger people. And foster global collaboration in traditional medicine. I think we do have here people from all different parts of the world. I have Dr. Yiludin, I met this morning from Thailand. I don't know who else we have from other parts of the world. Philippines also, right? Philippines, welcome. So, yes, Global Alliance is very important. And for Penang too, yes. I just came back from KL actually. Educate public about traditional medicine. I think very often the younger generation are quite, sorry the word used, the Singapore word blur, right? They don't really know what is traditional medicine. Oh, you mean those things that grandma used, grandma tales and grandma story, which is not true, right? If you understand what is traditional medicine, you will actually find it very interesting. In fact, modern medicine based on traditional medicine. All right. One of those things that we find in traditional medicine is like, for example, Ayurvedic and in Chinese medicine, the guru will touch, they will take the tamai, right? Take the pulse, and then after that they will look at your eye, look at the tongue, and ask you some question, and then suddenly they tell you what's wrong with you, right? Interesting, isn't it? It's all in the brain of the guru or the traditional Chinese medicine practitioner, but we don't really know what transpired in his brain. So to standardize all these things and to make it more relevant, we obviously use certain modern methods, right, to standardize. And education and training and improve public awareness of traditional medicine. So these are things that are very important because for traditional, for example, traditional Chinese medicine, which I'm pretty well versed with, it's always like father to the son, father to the daughter. It's a family kind of thing. Normally, they don't bring it and pass it on to other people outside, or they have this like disciples, so I'm not very sure maybe for Ayurvedic medicine, so the same thing, people just pass on the next generation. What happens if you have no children? Or next thing is you don't have people who want to learn, right? Okay, so it is very important that we are trying to encourage. We do this kind of talks where we can actually publicize and tell people what is actually traditional medicine. Okay, another three more points on our mission: preserve and promote traditional medicine. We are also into scientific research and international exchange. Now, what is important here is that if you understand that traditional medicine usually are very localized, they don't really go out, right? They're always practicing in their own village, town, and things like that. Whereas what we try to do is to bring it into an international forum, right? And I think that's where Singapore, as part of this global hub, right? We are the international financial hub, we are the international whatever hub, right? We also want to bring traditional medicine through Singapore platform into the world, right? Okay, based in Singapore and going global. So as you can see that Singapore is a launching pad for a lot of things. Even like for example, I think recently we talked about artificial intelligence. Global FinTech forum just passed, and very important that we are Singapore. We are always welcoming people because Singapore is the little red dot, right? We don't have anything except human beings. We are a platform whereby we want to engage the world, right? And all people are encouraged to come to Singapore, right? So Singapore passport is very powerful, right? You can go to most countries. At the same time, we also want other countries to come to Singapore, right? So starting from Singapore, we are going global, right? To reach out to all the various areas. So moving afterwards, and you can see that within the few months, we already started to go to China first, and then we are in KL. Then obviously the next place we like to visit is Dr. Aru's homeland. It's called India. In actual fact, I don't know whether people know that in last year, the United Nations, right, started a global traditional medicine center in India. Yes? Yes. Okay? So you're aware of it. So obviously one of the visits that we want to do is to go and visit the center and visit you, right, Dr. Aru? Yes. Okay. Okay, so this is a little bit of selling koyo, trying to promote membership. So if you can see that we encourage government agencies, academic institutions, healthcare providers. I know that there's some healthcare providers here from maybe the nursing home and places like that. You're always encouraged to join us. Okay, so currently in our membership, we already have some of these members, industry association, some NGO and traditional medicine practitioners. Okay, in actual fact, some of the traditional Chinese medicine association in Singapore, their president are actually members of our club, our association. Okay, so as you can see that whatever we do, we are always involving the industry. Because you can have traditional doctors, medicine doctors, but they need the herbs, they need the instrument, they need the equipment, right? So obviously we also encourage people who are producing this, obviously for example, energy has certain equipment and instrument that it can be used. Experts and scholars. So one of our, later on you can see that the first visit that we went to was Hangzhou Zhejiang University and Zhejiang Medical Hospital and also the Innovation Center. So this is one of those things that we want to get involved experts and scholars who will actually be able to give explanation, right, in terms of traditional medicine in a scientific way. Okay, empowering the traditional medicine and healthcare. So as you can see that these are the things, or this is the what kind of things that we would like to do. Obviously, exhibition, market expansion, publishing, discussion, and we are also planning for next year to actually launch our so-called conference, maybe in conjunction with Energy, right? Okay, so this is the kind of things that we have in terms of processing. Yes, I was the one who actually had to start a social enterprise in the Salvation Army. Obviously, we go through a systematic process. And over here, this is some of the process that we are thinking of having to operate projects in terms of how we to expand the traditional medicine with all these things. So these are reports, discussion that we're going to have, set up phase completion project, Singapore International Seminar or Trade Fair, right? Okay. Well, why to join WTMHA, World Traditional Medicine and Health Association? So as you can see that we are actually able to also expand your influence over through networking, accessing resources, obviously through our members and people who are interested in expanding traditional medicine, we can always share these resources. participating in decision making. In actual fact, some of our members have access to, for example, the Minister of Health in Singapore, right? So they had discussion with him, and we are trying to say that there are much more things that we can do, right, for traditional medicine in Singapore. So I think if you hear the news, there's integrative medicine, using traditional medicine together with the so-called Western medicine. Okay. Okay, expanding network. So like what you say, we have the Filipinos, we have the Thai people, we have people with many different network. We can link up with each other and we can synergize. And also for India, definitely. Yes. Okay, I won't bore you with all this. I'm sure you know, if you would join us, you will have all these benefits. Obviously, what's important is that being a member of this association, you will be able to interact, we can do sharing, we can actually leverage on each other, right? Okay, so these are the actual fact we call contracting agency. These are the organizations that we have already started to set up some MOU or organize. These are all the, you see, as you can see, it's all Chinese. Okay, the next time I would like to have is Indian, right? Okay, the contracting agency will be the Indian one, you know, and also the Filipino one and the Thai, right? Okay, so we have more agencies that will work together with us. Okay, so as you can see that in the short time that we started in this association, we have gone to China to visit Hangzhou, and in actual fact, in our team there is a very good media lady who actually able to do all this publishing in China. So these are the related activities that we have gone through. We visited Hangzhou, and we also visited the Chinese embassy here. We invited for some dialogue. Okay, key strategies for supporting active aging. Obviously, we are active aging talk, right? So I must say, what are we going to do, right? Okay, we are proposing obviously personalized health plans, and when Dr. Arun was talking about, patient centric, isn't it? Yes. It's very important. It's patient centric or personalized, right? Personalized health plans. It's not something which is you just do it. You go and see a doctor, you give medicine, and that's it. So we want to see how we can personalize, not only to the person, but we want to have a health plan because it's a lifestyle, right? It's a lifestyle. So it's something which you need to do it intentionally, right? Preventive care as core service. Now, I think there's a lot of things. Okay, when you're sick, right, you're not well, then go and see a doctor. I think that's already too late, right? You should actually do preventive care. And I would like to, for all the Singaporeans here, right, if you don't have Healthy 365 app on your phone, any of you have that? All of you have, right? Healthy 365, you have it? Yes? And you make sure you use it. I think most important, the government spend a lot of money, right? Promoting health in Singapore, our government is really very conscious of health, Healthy 365. Oh, Michael doesn't use it. Next time I must make sure he do it, right? Okay, so I tell you, if you don't have this app, Healthy 365, please download it and then very seriously start to use it. Okay, I started using it when the thing was launched, and I thank God, really I learned a lot of things. Because you were talking about active aging, right? How to stay healthy. But when your lifestyle is bad, right? Okay, when your lifestyle is bad. So the thing is that how do you know that? Okay, like, for example, when I started to use this thing, then I realized I was not exercising. I go for my walks and do whatever, but then I realized, oh, actually, according to the app, the Healthy 365 app, I'm not exercising. All right, because inside this app, they mention not only steps, right? Most people use steps, right? But there is what you call MVPA, all right? So MVPA measures how fast your heart is pumping, Right, so which is very important because sedentary life is like sitting down, So your heart is like, but if you start to exercise, right? And important is, I believe that it is very important for us to have active aging, right? And to have a purposeful life. That's very important, right? So like what we say that all these things, preventive care is very, very important, right? Hybrid care models, all right? So I think this is very interesting because every time we talk lot, we think, oh, medicine is only for doctors. It's not only for doctors or nurses, right? We have to integrate the virtual wellness consultation, tele-coaching, person visit, ensure consistency. Okay, so what I'm trying to say here is that, especially during COVID period, right? We all cannot maybe physically go and see a doctor, right? And then this way the tele-medicine become very important. The doctor can actually prescribe the medicine to us, send us the thing, right? The next one that knock at your door, right? To deliver all this is your medicine, right? Okay, strategy 2, leveraging technology for wellness innovation. Okay, wearables and remote monitoring. So these are things that I think you all not now know, right? I'm sure the rest of the people, but some of you have these wearables where it actually helps you to monitor your health, right? At the same time, naturally, some of these are pretty good. If you have a fall, right? If I have a fall, this thing will call somebody, right? Okay. Um, Tech literacy workshop. I think a workshop like this is very good where people, in actual fact, when you talk about energy medicine, a lot of people doesn't know what you're talking about. Energy got medicine, man, medicine got energy, man, you know. So they don't know. And like for example, Dr. Michael will be talking about his coffee and things like that. Very good, you know. And Veronica is going to share about energy, you know. I'm an active Grab Hitch driver. So if I pick you up, right, don't be surprised. And one of those things I do is actually talk to all these potential, all these people who really do not know about energy science, energy medicine, you know, and then I will pass them my card and say, you want to have a free checkup? They say, wow, got such thing, man? Yes, come, right? Smart home integration. I think obviously for active aging, it starts from the home, isn't it? Right? Because home is our base. So like what the Dr. Arun was sharing just now about sleep. So if we don't sleep well, then our lymphatic system not working, our immune system will be degraded, you know. So obviously, like, energy has all the devices, and in actual fact, one of those things that I share with the people I talk with is about sleep. Because everyone sleep, right? Yes?
Yes.
Yes? Elaine, you sleep, right? Last night, I hope. Yeah. So sleep is very, very important because if you don't sleep well, you know, one third of your life is miserable, isn't it? Okay, and smart home integration also talks about, you know, a lot of things like Dr. Michael Tan is going to share about, you know, how to make your home, you know. I don't know, I'm not sure it's not, but I'm sure he can share with you to make your home very safe, right? In terms of all the things that you cannot see, right? All right, then okay, let's move on. Strategy number 3. Delivering comprehensive for education and for older adults and care providers. Okay, empowering caregivers. I think as most of us will have maybe grandparents or parents, right? And you need to give care to all these elderly or seniors. Obviously, we need to empower you, right? Because if having the knowledge of energy science and things like that, it will help you. Traditional medicine is one area whereby you can actually be empowered to do something for your loved ones. Okay, so as you can see here that we are living in this place, we can see that there's a lot of contamination, right? Okay, tech literacy workshop as mentioned before, and ongoing health education. So these are kind of things that which I think is very important. Public awareness, people know where to get the help, you know. Okay.